Everyone feels anxious sometimes. It's a natural human emotion that we all experience from time to time, like before a big test, when the pressure is on and you need to perform your best. The stakes are high and a little anxiety can actually help you focus. Or a job interview, a situation that can determine your future career path. It's normal to feel butterflies in your stomach, or when making a tough decision. Weighing the pros and cons, considering all the possible outcomes, can be a source of considerable stress. This is your body's natural alarm system, a built-in mechanism designed to protect you from potential threats. It's keeping you alert and ready, preparing you to face challenges and overcome obstacles. It's a survival instinct that has served us well throughout history. But anxiety disorders are different. They go beyond the normal, everyday worries that everyone experiences. They're not just passing worries or fleeting moments of unease, they are persistent and pervasive. Imagine your internal alarm stuck on high, constantly blaring, even when there's no immediate threat. It's like a false alarm triggered by nothing, yet causing intense distress and discomfort. This constant fear can make daily life, the simple act of getting through the day, work, school, relationships, and social interactions, feel like an uphill battle. Feel impossible. It can drain your energy, cloud your judgment, and leave you feeling completely overwhelmed. The difference? What sets anxiety disorders apart from normal anxiety? Normal anxiety is temporary and tied to a specific event. It fades away once the event has passed. Anxiety disorders are intense, long-lasting, and disrupt your life, interfering with your ability to function normally. You might avoid situations, social gatherings, or even leaving your house altogether, feel panic for no reason, experiencing sudden and overwhelming waves of fear that seem to come out of nowhere, or find your world shrinking as you limit your activities and interactions to avoid triggering your anxiety. Anxiety disorders are real medical conditions, recognized by healthcare professionals and requiring proper diagnosis and treatment, not a sign of weakness. It's important to remember that seeking help is a sign of strength, not failure. Recognizing this is the first step to getting help, acknowledging that you're struggling and that you deserve support. If your worries never seem to go away, if they are constant companions that follow you everywhere, or you feel panic without cause, experiencing intense fear and physical symptoms even when there's no apparent danger, it could be more than everyday stress. It might be time to consider that you could be dealing with an anxiety disorder. You're not alone, and it's important to remember that. Millions live with anxiety disorders, and many of them are successfully managing their conditions with the right support and treatment. Understanding what you're experiencing, recognizing the symptoms and patterns of your anxiety, opens the door to support and treatment. It's the first step towards taking control of your life and finding relief. There's hope, and recovery is possible, and help is available. Don't hesitate to reach out to a healthcare professional or mental health expert to explore your options and begin your journey towards healing. Anxiety comes in many forms, and understanding these different forms is the first step towards managing them. It's important to remember that anxiety isn't just one thing, it's a spectrum of experiences. Generalized anxiety disorder means constant, almost daily, uncontrollable worry. It's a persistent state of heightened anxiety. This worry often revolves around everyday things, health concerns, financial stability, or work-related pressures. It can feel like a never-ending cycle of anxious thoughts. Panic disorder brings sudden, intense panic attacks, episodes of overwhelming fear that seem to come out of nowhere. These attacks are often accompanied by physical symptoms like a racing heart, excessive sweating, and a terrifying fear of losing control or even dying. Social anxiety disorder is more than just simple shyness. It goes much deeper. It's a deep-seated and persistent fear of being negatively judged, scrutinized, or embarrassed in various social situations. People with social anxiety may avoid public speaking at all costs, find it incredibly difficult to meet new people and initiate conversations, or even feel intensely uncomfortable eating in front of others, fearing judgment. Phobias are intense, irrational fears of specific things or situations. Common examples include a fear of heights, spiders, or flying, and the level of fear is far beyond the actual danger posed by the object or situation. These intense fears can lead to significant avoidance behaviors, disrupting daily life, and in some cases, triggering panic attacks. Each type of anxiety, with its unique characteristics, can significantly limit your life, impacting your relationships, career, and overall well-being in distinct ways. Recognizing the specific symptoms you're experiencing is a key first step towards understanding your anxiety and finding the right kind of help and support. Anxiety is a deeply personal experience and manifests differently for everyone, but it's always a real and valid struggle. Anxiety disorders are complex conditions, and their development often stems from a combination of factors. Genetics, brain chemistry, specifically the delicate balance of neurotransmitters, and a wide range of life experiences all play a significant role in predisposing someone to or triggering anxiety. If a close family member has struggled with anxiety, your risk is statistically higher, suggesting a genetic component, but it's absolutely not guaranteed that you will develop an anxiety disorder. Imbalances in crucial brain chemicals like serotonin, which regulates mood, can significantly make it harder for individuals to effectively manage stress and regulate their emotional responses. Traumatic or particularly stressful life events, such as loss or major life changes, can act as a trigger for anxiety, especially if that stress is unaddressed and allowed to build up over an extended period of time. Diagnosis of anxiety disorders isn't typically done with a blood test or any single objective measure. Rather, it's based on a comprehensive evaluation of your reported symptoms and the degree to which they negatively affect your daily life and functioning. A qualified mental health professional will conduct a thorough assessment, asking detailed questions about your feelings, your recurring thoughts, and any patterns in your behaviors that might indicate anxiety. They'll then compare your reported experiences and symptoms to established medical guidelines and diagnostic criteria to arrive at the most accurate and appropriate diagnosis. This careful and considered process ensures that you receive the specific and tailored support you need to effectively manage your anxiety and improve your overall well-being. The good news: anxiety disorders are treatable. Cognitive behavioral therapy, or CBT, helps you challenge negative thoughts and learn new coping skills. Exposure therapy, often part of CBT, gradually helps you face your fears in a safe way. Medication, like SSRIs, can help balance brain chemistry and ease symptoms. Sometimes therapy and medication work best together. Your treatment plan will be tailored to you. There's no one-size-fits-all. It may take time to find what works, but improvement is possible. Working with a professional helps you regain control. With the right support, anxiety can be managed. Recovery is within reach. Alongside treatment, self-care matters. Regular exercise releases mood-boosting endorphins and reduces anxiety. Limiting caffeine and eating balanced meals can help stabilize your mood. Building a support network, friends, family, or support groups, makes a big difference. Sharing your feelings reduces isolation and brings comfort. If you're struggling, talk to your doctor. They can guide you to the right help. Recovery takes time, but it's possible with the right strategies. You deserve to feel well again. There's always hope.